Hello, everyone. This is Joel Torres from the Alcohol and Drug Abuse Prevention Team, here to present you with a first of a round of webinars or trainings that we will be doing remotely via presentations online. We want to make sure that we can get messaging out to our community in a timely manner, and we also want to make sure that we train our coalition members and the general public in some topics that they would like to learn and would like to hear from individuals in our team who've been involved in public health and substance abuse prevention efforts in Essex County over the past 8 years as part of the alcohol and drug abuse prevention team. So today, the presentation will be on developing strong and lasting coalitions. This will be a coalition building overview to give you the steps and the strategies to help you develop an effective coalition in your area to focus on your intended health outcome. A little bit of an outline of what our presentation will look like today. We'll start with some background information just to get your foundation set on who we are as far as what ADAPT is, where we're getting some of these thought processes and concepts from. We'll go through coalition basics. We'll talk through some public health approaches. And then we'll educate you and give you some information on the strategic prevention framework, which is the model that we follow at ADAPT. And a lot of our partners follow, which simply helps guide you through a process to make sure that you effectively do work in your community. After that, we'll let you know some tips on how to legitimize your coalition and make sure that they are long-term, long-lasting, and give you some thoughts on what's next now that you have the basics in front of you. After that, we'll ask you to please complete a survey just to give us some thought processes and some ideas on what you think would be more effective for future surveys. And we hope that you can take the time to fill out that survey for us. A little bit about myself. As I stated before, my name is Joel Torres. I am the manager of the Alcohol and Drug Abuse Prevention Team. Thankfully, I've been here for 8 years working throughout the county of Essex on substance abuse prevention efforts, building our coalition, strengthening the work that we've been doing, and supporting our community and improving the public health outcomes that we have all throughout the community. I have a bachelor's of science in public health from Montclair State University from back in 2011, and I have a master of arts in public and organizational relations, once again from Montclair State University. I'm also a master certified health education specialist, which is a certification that you can get to work on public health matters. This is a national accredited program. All right, let's start with the background. Give you some ideas on who ADAPT is and who is CADGA, which is a national model that we follow, a national group that we work with. So the Alcohol and Drug Abuse Prevention Team, as I stated, we've been around since 2012 in Essex County. Our goal is to reduce underage drinking and drug abuse throughout the county itself. We do that through empowering youth leaders and community members and collaborating with various partners. And I'll touch base, I'll discuss sectors in a little while. And those are the sectors that we focus on here in Essex County to work on anything from education all the way up to policy changes and programmatic changes. Our goals, first and foremost, are to build collaborations with these individuals in these sectors. And then, of course, reducing substance abuse, substance use in the county itself. And with that, hoping that we can improve the overall safety and health of every resident in the county. Our structure, so except for our 5 staff members, we are a group full of volunteers of youth and adults working in those different sectors that I will explain in a little while. We collaborate on various initiatives, various programs, and we look to plan and organize together as an effective coalition. And I'll explain a little bit more of what you can do to make sure that your coalition is effective moving forward. We are managed by Family Connections, which is based out of Orange or East Orange, New Jersey. Been around for over 100 years, doing effective community work and nonprofit work, including mental health treatment, substance abuse treatment, and other prevention programs like ADAPT throughout the community. And some of it we will touch base on in a little while. We're funded through various grants from the New Jersey Division of Mental Health and Addiction Services and the White House's Office of National Drug Control Policy. So our focus as you look to develop your coalition, you have to make sure that you have a focus and you have a targeted health outcome that you want to work towards. In our efforts, we work towards reducing underage drinking, prescription drug and prescription medication misuse and abuse, and tobacco use among youth. Well, we're looking, of course, to decrease access, but also changing community norms, changing behavioral norms, and changing the policies, practices, and programs that might lead to an increase in substance use or access to drugs and alcohol in the community. Of course, one of those pieces is through education, but then, as I stated, you want to move forward and move to a deeper uh, groundwork when you're working towards policy change or programmatic change. If you look at the last bullet, it's talking about the uh, 7 strategies for community change from CATCA, and I will explain what that acronym means in just a short while. But as you look through the bullet points, through that bullet point, you will see that you start with that education piece, providing information, and you move all the way down through it until you're modifying and changing policies. And that last piece is not last because it's the least important. That's actually where you want to get to as you build and develop the work that you're doing with your coalition. We have several committees that work on the programmatic level and trying to implement the work that we're doing here. As you look to build your coalition, you will have your main coalition, which is the big group of individuals, but then you want to get down to committee levels where you're working effectively with a small group of people to do the changes and to plan and implement the changes that you want to do in your community. So at ADEP, we have 4, starting with the underage drinking committee. And as you can see there, we focus on planning and implementing the underage drinking prevention initiatives. Some of it might include sticker shock campaigns, which are basically working with our local liquor stores and our police department to raise awareness to the community about the dangers of purchasing alcohol for minors. As you move down, we have a prescription drugs committee with a very successful campaign that we've worked on over the past 8 years called the Permanent Disposal Sites Campaign. You'll see a little bit of that a little bit later, but that initiative is basically installing what looks like a mailbox inside of a police department. We were able to get that from just 2 sites in 2012 to now where we have 20 sites just 8 years later. We have our interfaith steering committee that focuses on involving and including our interfaith community here in the work that we're doing for substance abuse prevention and making sure that we all understand that our communities are impacted by this, and our faith leaders are trusted resources and trusted sources of information in their community. Therefore, it's very important to get them to help spread the message and raise the awareness of the impacts of substance use, substance abuse here in the county. Finally, we have a new committee that we've started called the LGBTQ plus committee. And this is a collaborative committee with ourselves and NJCRI from Newark, working on prevention efforts, substance abuse prevention efforts, specifically targeting the LGBTQ plus community. Now to that acronym I mentioned before, CATCA. It stands for the Community Anti-Drug Coalitions of America, and it's an international membership organization that has over 5,000 community groups or community coalitions as a part of it. They help us, and they help us focus on our efforts, give us technical assistance, give us trainings and various programs to expand our knowledge, but also to make sure that we are doing effective work in the community that will make lasting changes. They host national conferences that we usually attend at ADAPT and other partners that we have. It's a very effective support and resource for you as you build your coalition. A lot of the work that we do with CATCA is focused specifically on substance abuse, but it's also good to get those resources, get that information from CATCA, depending on what type of coalition you're building, what type of health outcomes you're looking for. So CATCA organizes this big training that I stated earlier, which is called the National Coalition Institute, and it has three primary goals. First and foremost, to provide education and training and technical assistance for coalitions and their community partners. Next piece is developing and disseminating evaluation tools. And the final piece is bridging the gap between research and practice to make sure that what you're doing in the community is something that's evidence-based and something that will, as I stated earlier, provide lasting changes in your community. So now let's talk about what coalition basics are and kind of learning how to form your coalition and how to build your coalition. All right, so going back to what I stated earlier, as far as the various sectors are concerned, you will see in this image right here that there are different sectors that develop the drug-free communities, which is a part of the coalition building tools that we have here at ADAPT. So in the work that we're doing, we focus on increasing sector representation from these different areas, including youth, parents, businesses, media, all the way through to healthcare professionals, law enforcement, and schools. The goal of building a community coalition is to develop effective partnerships that will help you break down the siloed systems. So one of the things is we're always working effectively to support our communities and to build changes, but sometimes we're working in silos. Therefore, we don't get opportunities to talk to each other to figure out what one another is doing and how we can either decrease duplication of services and increase shared resources, or just make sure that if somebody else is doing something, that we can try to figure out a way to support that in a way that's effective to the work that we're doing. And that helps develop cross-disciplinary problem solving, because now we have different groups that have a lot of skills, a lot of knowledge, and they can help support us in a way that can help improve the targeted health outcome that we're looking towards. So reading specifically from Katka's definition for a coalition, I don't like reading verbatim from presentations, but this is somewhere where I like to make sure that I give you the details. So a coalition is a formal voluntary arrangement for collaborating among groups or sectors of a community in which each group retains its identity, but all agree to work together toward a common goal of a safe, healthy, and drug-free community. So as I stated earlier, the work that you're doing is your work, and you will not lose your identity in the work that you're doing. However, you're building strength and you're building collaboration and support with other individuals who can help you strengthen the work that all of you are doing together. So what makes a coalition effective? First and foremost, it's important to make sure that you have strong connections and strong ties to the community that you are serving. So it's somewhere where you have relationships that know the community, that know what's been impacting it, that knows the history of the community itself and the health outcome, how the targeted health outcome that you want to work towards, it has been impacted in the community. And when I speak about targeted health outcome, this can be from our aspect, we're working on substance abuse. You could be working on nutrition or obesity or breast cancer. So these are different health outcomes that you are targeting and that you want to work with the community to make sure that you know their history, know what's been done in the past, what's worked, what might not have worked in the past, who are the partners, who are the players, and how you can make sure that you bring everybody to the table to be part of this coalition. And it also helps you make sure that you can recruit those key stakeholders in your community who can help you make long-term changes and help support the long-term changes that you want to work on. You also understand that you are not a program. You're not a program. You're not an organization. You are a group of people who work at separate organizations, separate programs, coming towards a common goal to develop the best strategies that can address the local health problems in your community. And if you heard I said you are not a program per se, because then that's where things get confusing as far as what's a coalition and what's a program. So I've got a couple of different things to help you understand the difference between a coalition and the difference between a program. So the first and foremost, coalitions measure success by examining community level indicators and outcomes. So you're looking at the entire community and what impacts how you've been able to impact the health outcomes in that entire community. So, for example, in our case, we do a every other year we do a survey with schools throughout Essex County, and we're looking at how have we helped decrease 30-day use of drugs by youth, how we work to decrease the lifetime use of drugs by youth, and their perception of risk or harm by using these drugs. So we're looking at the entire community. We're not looking at the just one individual. That would be a program when you're looking to measure how the work that you've done has impacted that one individual or a set of individuals. As a coalition, you're looking to ensure that all causes of identified problems are addressed. So you're going to develop a logic model, which I'll speak about a little bit later. But with that, you're looking to kind of find out what are these local causes, what are these root causes that are impacting the targeted health outcome, and how can I do work to specifically target those causes. When you're a program, you're looking at a single strategy. So you're working a parent class or a parent group, like a Strengthening Families program. You're doing tutoring or after school programs with children. So you're not looking to target all of the things that impact a local your targeted health outcome. You're working on one strategy. And finally, coalition activities are planned and worked on by all members with staff coordinating and providing support. So this is all hands on deck. Everybody's working together, everybody's collaborating. When you're a program, you have paid staff who are doing the entire thing, leading the process and doing implementation and evaluation. With a coalition, it's a collaborative effort. This kind of gives you a clear picture of the sectors that you should have involved in your coalition. And I kind of spoke about that earlier, but just to give you an idea of what we have at ADAPT, anywhere from parents to law enforcement to members of the faith-based community, of course, because we have that interfaith steering committee, to youth serving organizations, members of the media, of course, because you want to get information and news about your coalition out there to the community itself. And if you're trying to find out what the benefits are of forming a coalition. So I've just spent 15 minutes listening to Joel. But what's in it for me? What's in it for my organization? What's in it for my community? First and foremost, like I said earlier, this is not just for substance abuse prevention. Even though I'm giving you guidance or information that's been brought by CADCA and other partners, this is something that you can use for any health outcome. So, for example, if you are looking to target nutrition in your community, it's good to have a coalition that can collaborate and you can get input from various partners. Say, for example, if you want to get somebody from law enforcement involved in the conversation, you can find out from them what do you think are issues that are impacting the nutrition and the health and wellness of our community. And they can give you their input, their minds, their thought processes, because just because we think about law enforcement just for enforcing the laws or arresting individuals, uh, they also have good ideas, good thought processes on what can be done to improve the health and wellness of a community. As I said earlier, it helps break these silos so that we're working together, we're collaborating across disciplines to make sure that we can effectively change the community. And it gives others an opportunity to learn from public health efforts and to contribute their voice. And if they hear that they feel that their voice is being heard, they're going to want to work together to make sure that they improve the health and wellness of their community. And finally, it gives individuals an opportunity to work to tackle the actual root causes that are impacting health and wellness in your community. So a lot of times with a program, the programs are effective, but the programs are not always working towards that root cause. When you develop a coalition, you can actually dig deeper into what are the root causes leading to these issues that are impacting our community, and how can we work together to tackle those root causes. So now that I gave you a background on what is a coalition or the basics of a coalition, I want to give you a little bit of perspective on the public health approaches that can help you and guide you as you continue to move forward with the work that your coalition can do in your community. So before we move on to the models themselves of public health, let's just talk over the actual approach that is public health. So this involves defining and measuring a problem or your targeted health outcome, determining the cause or the risk factors for that problem, determining how to prevent the problem or improve the health outcome, and implementing effective strategies on a large scale, and then evaluating their impact. So it's kind of from defining what the actual problem is all the way down to making sure it works in your community. One example, sticking to the substance abuse prevention efforts that we do here at ADAPT, and it's being done by CATCA. We're looking at addressing substance abuse prevention through the public health approach, looking at what the substance is. So that's the agent, what agent is being used by the community or by youth and adults, which are the hosts. And then how can we reduce those conditions, which is the root causes in the environment. So as you can see by the image there, everything interrelates. So the agent, I'm sorry, the agent or the host is using the agent, and that's having or that's being impacted by the environment, by the root causes. And of course, the environment, the root causes impact the host as well. So it's all interrelated. One way to think about root causes are those main issues that are impacting your community. We can look at this image right here that teaches you about downstream to upstream prevention. So, in the work that your coalition is doing, you want to go towards the upstream level, which means you want to do things that will impact the entire community and that will lead to policy and programmatic changes that can affect not just the current community, but communities for decades and generations to come. So right now, some of you might be working in the downstream area, which is, say, for like one example is the programmatic level, affecting the individual or the families. So you're doing programs that target certain things. So your programs target obesity, target incarceration, they target poor health status, nutrition, etc. As you move further upstream, you get to the midstream level. There you're looking at community level changes. So as you develop your coalition, you might be doing things at the midstream and at the upstream level. If you look at what it says there for midstream, you're moving people from conditions that decrease health and well-being to conditions that support them. So you're increasing access to different services and programmings. You're making sure that they're getting physical activity, and you're making sure that they are economically stable. And as you move to more upstream, you're looking at that societal level change, that programmatic or policy level change that impacts the entire society around them. So if it's a safer neighborhood, if it's less food deserts, so there's more food options and healthy food options in the community and a healthier environment, you're moving towards that upstream level. There's four key theories when you talk about public health: the health belief model, the trans theoretical model, the social cognitive theory, and social ecological model. The health belief model looks at a person's beliefs and how they feel that that is a personal threat or that will impact them per se. So their belief that an issue, an illness, a drug, etc., will negatively impact them leads to their belief in the effectiveness of taking the recommended behavioral changes or programmatic changes or outcome changes that you are addressing or promoting to them. So, for example, we work on trying to increase the perception of risk in using drugs and alcohol at a young age with youth. One of those strategies can be through curriculum based programming in schools. And as we impact that change in their belief and their perceived risk, that will then improve the likelihood of them not using drugs and alcohol at a young age. There's also the trans theoretical model, also known as the stages of change model. This is looking at the fact that decision making is there's people who are at different levels when it comes to making a decision in changing their behaviors or keeping their behaviors, and that it's an intentional change that people are making. You know, we're not assuming that people are at the same level. So, say for example, if I already know that I do not want to use drugs or alcohol, I'm already at a certain level where I took action because I'm not doing that, but I'm also maintaining that over the years. So I would be at the maintenance level. If you have an individual who is not eating healthy, they're not working out, that individual is at the pre-contemplation level, that first level, that blue, dark blue level that you see in front of you. That is where they are unaware that they are doing unhealthy things, or they might not know what strategies to take to improve their health and wellness. And this is where you come in to help them. So individuals are at different levels when it comes to uh, their behaviors or their thoughts and beliefs on changing their behaviors. The social cognitive theory looks at uh, explaining to you that learning occurs in a with a dynamic and reciprocal interaction of the person, environment, and behavior. So that's to let you know that there's different things that impact and determines a person's behavior. So if you look at the teal colored box, you know, there's the personal factors like their current knowledge. So there might be people who don't really know that marijuana is not good for them. Uh, it's not a good drug for them to be using. There might be young individuals who are thinking, well, I keep on hearing news about it being legal or the medical reasons why we should be using, and they don't really know the health effects of it, say, for example. Then you look at the blue box, it's talking about the behavioral factors, their skills, their practice, their self efficiency. So if you have someone who is cognizant of what they're consuming, so they are eating a healthy diet, they are working out, that's their behavioral factors. They're already behaving in a way that improves their health and wellness. Then you look at the environmental factors. So you have a person who is eating healthy because they have healthy options around them. That's the environmental factor. You have healthy restaurants for you to be at. There might be somebody who might not have that option. They might be living in a food desert, and that's the environmental factors that lead to their behavior of not eating well and their lack of knowledge of what is there for me to eat that's healthy around here. And finally, there's the social ecological model, which is looking at the complex interplay between the individual, relationship, community, and societal factors. So everything has a hand in the knowledge, skills, the behavior of an individual, and also the individuals around them. So it's understanding the range of factors that put a person at risk of unhealthy or risky behavior. Now, when you're working on strategies, there's a level of focus that you work on. There's the individual focus strategies. So that's targeting the individual. So looking at just the person, either building their skills, providing them with information, or providing them with their level of support. And you'll hear more of this a little bit down the line, but I just want to make sure you get an understanding of what the level of focuses are. Then you have the environmental focus strategies, which is looking at the community level. So what are we doing with the community norms, with their behaviors, with um, their thought processes, and what are we doing to promote laws, ordinances that will positively impact community behavior and improve the health and wellness of the community itself. As a coalition, you're looking at the full environmental strategy level of making changes that will impact the entire community and entire population, not just one individual. If you look at this as a continuum of care, prevention is only one section of a full continuum of care that's within the community itself, from prevention to treatment to maintenance. And I'll speak more about this from an example of the work that we're doing here with substance abuse. There's three levels, as I stated. There's prevention, then there's the treatment community, and the maintenance community to continue to maintain healthy behavior. If you looked underneath, and at the first aspect is the promotion piece, this is where you're talking to just the general public, just talking about promoting health and wellness. So, for example, if we are promoting the prescription medication disposal boxes that I spoke about earlier, we educate the entire population. Along with that, we let them know that there is a high value of risk in using medications that are not yours, and in abusing medications that are not prescribed for you. So we're doing a promotion. We're not targeting a specific group. We're doing one full thing for an entire population. Then there's the universal preventive level, which you're targeting the general public that has not been identified based on individual risk. So we don't know how impacted a certain level of the community is, but we're still doing a strategy to prevent use and abuse in that entire group. For example, when it comes to prescription drug abuse, we at ADAPT, we also do what's called a brown bag day. That's a localized prescription medication take back initiative where we go with police officers and pharmacists to visit senior homes, senior centers, and educate seniors on, uh, you know, the impact of prescription medication abuse, that there might be individuals in their families who might be suffering with a substance use disorder, and they need a medication to feel a certain way. So that's why they steal it from a family member's or loved one's house. So we give them an opportunity to collect any old or unused medication and dispose of it through our visits with the police departments. This is a universal approach because we don't know what the individual level of risk is, but we're doing a preventive measure just to make sure that we decrease the use and abuse. Next is a selective preventive. So it's targeted, you're targeting individuals or a population subgroup who's at risk of developing negative health outcomes. So we know that they're at risk and we're targeting them specifically. And finally, there's the indicated preventive level where you are targeting high risk individuals who are identified as having minimal but detectable signs or symptoms of negative health outcomes or biological markers indicating that they're predisposed to negative health outcomes. So as you go from promotion all the way down to indicated, it's more of a targeted approach to prevention, from just doing something that's for the entire population to indicated where it's something specifically targeted towards a certain group of people. So with that, we'll get to what's going to be the bulk of the rest of this conversation, which is educating you on the strategic prevention framework model and why you should be using that for your coalition and to build your coalition, because it is a national model of prevention and it's a national model that you can use to do the effective work that you're doing. Now, the strategic prevention framework has 7 steps to it. As you can see, this flower symbol that we have here, this very colorful flower symbol, is a very effective tool that we use as coalitions to guide the work that we're doing. It starts from the red level, which is the assessment level. So everything that you're doing when it relates to health and wellness or any programs that you're trying to develop, you should first start from that level, from assessing, collecting data, trying to find out what the gaps are in the needs and services that need to be in the community. Moving now towards the right of the image, you go to the green, which is capacity. So that you're starting to develop that data, you're looking to find out what targeted health outcome you are working towards. Next, you move to capacity. You want to build that capacity, build that group of coalition members who are going to help you address the issues that you are targeting in that community. As you move down to the purple, which is planning, now you're looking to develop a strategic plan to target the work that you're doing in that community. Then you move to the blue, which is the actual implementation. So you have your plan, you know what you want to do. Now you have to put it in place. Going towards the yellow, which is evaluation. Now it's how do you measure the success of the work that you've been doing to work on that targeted health outcome. And finally, in the white in the middle, there are two levels, which are cultural competency and sustainability. So you want to make sure that you are culturally competent to the diverse populations that you're dealing with in your community, and also that you are building long-term sustainability for your coalition. So step one, as I stated, is assessment. You're looking to develop a community assessment to get a comprehensive picture of your community, and making sure that you can detail and explain that comprehensive picture to any potential funders in the future. Now, this process is systematic, so you're very targeted in gathering and analyzing whatever information you can get that tells all the details about the community that you are trying to serve and the targeted health outcome that you are working towards. Now, if you want to be effective, you need to understand that your community strengths, or you need to understand your community strengths, needs, resources, and their how they look will change over time. So you need to continue to update your data, update your information. It's not just a one stop, I'm going to do one community assessment and that's it, I'm done. No, it's do this community assessment and then a couple years later, reassess the information and try to find out what's going on. So now that I explain what the assessment is, let me detail what's within it. So first and foremost, you want to define and describe your community. Are you doing a city? Are you doing a ward or just one neighborhood in your city? Are you doing an entire county? Be detailed on what that community is, what the boundaries are. Make sure you identify features of the community environment that's impacting your targeted health outcome, and describe the communities within the community. So look at census data, look at information to find out who are the people here in the community that we're serving. What is their racial and ethnic makeup, etc. Then talk about the history. So what history is there with your community? Uh, what what details or what information do you have of how the targeted health outcome has impacted them and their well-being over the past century, generation, etc. Whatever data you can find out, whatever information you can find out, it's very effective for you to find that out. And also kind of detail what prevention work has already been done, and how is that effective, or how has that been effective or not effective in that community. And if it's been effective or ineffective, I would say recruit those individuals who've been working on that problem and bring them to be part of your coalition as you move forward. Next, you're looking to collect needs and resource data. So, what data can you find out that's relevant to what you are talking about, your targeted health outcome, and the consequences, the root causes, the local conditions, the demographics of your community. Find out whatever important data or relevant data you can find. Use quantitative data, so that's numbers, quantity numbers. Whatever data you can find through surveys, through any police records, universal crime reports that you can find, any hospital records that you can find, any data that's available. If you have any partners that you're currently recruiting to your coalition, it's a good opportunity for you to say, hey, we're going to have a data collection, data work group meeting. Let's get together, bring any data that you have related to this target health outcome so we can find a clear picture and give a good story about the community that we're serving and the impact of the targeted health outcome in that community. Next, you also want to find out qualitative data. So do community forums, do focus groups, listening sessions, key informant interviews where you are getting now not just the numbers, but also stories and information from key stakeholders to back up the numbers, or to also, they might conflict with the numbers. So they might tell a deeper story, or they might tell other stories or other things that are going on. Then you're going to conduct a problem analysis for your particular targeted health outcome. So this is where you have all this data, you have all of this information. Now you're working in groups to kind of analyze all of this information and find, okay, now this is the why, but now we're going to ask, but why? Why is this happening here? Why is this root cause a root cause that's affecting our community? So, for example, if a root cause for malnutrition or obesity is we live in a food desert and we don't have enough healthy food options. Okay, but why is that a problem here in my community? Dig deeper into that root cause and try to find out what is the actual impact that's occurring here. Include and incorporate the experiences and expertise of your coalition members uh, through this process. So get that community input, make sure your key stakeholders are on the table, and build a clearer picture of what this looks like in your community. And then you want to select objective criteria that's going to facilitate the prioritization of the problems, root causes, and local conditions. So you don't want to have conversations for 3 months about this. You want to make sure you have a clear deadline and you have a clear picture of this is the criteria that's going to meet our threshold to say this is the problem, this is the root cause, and this is the local condition in the area that we are working on. With this, then you will create a logic model for each targeted health outcome that you're working towards. So now you're going to move from that analysis piece to developing a living document, a working document that's going to be clear based on the criteria that you put out there of what the root causes are, uh, what the local conditions are, and what you want to work on, what strategies you want to work on to impact that. That's going to be your roadmap moving on the line to make sure that you're creating something effectively that's going to create community level change. And as I said before, with the other piece, now you want to go into your group setting with your coalition and debate, argue, critique it, not forever, but just for a short amount of time to make sure that that logic model effectively talks about your community and what's impacting your community. You want to make sure, as I stated earlier, about risk and protective factors. You want to make sure that you discuss this and that your logic model identifies what the risk factors are in your community and what the protective factors are. So the risk factors, if I didn't explain this already, the risk factors are what are things in your community that are leading to negative outcomes for whatever targeted health outcome you want to work on. So the risk behavior is, risky behavior. Think about it that way, negative. What is causing your community to be more at risk of not being healthy at this current point? Protective factors are what are factors in your community that are increasing the chances of your residents being healthier or actually having positive outcomes when it comes to your targeted health outcome. So think about it that way. You want to make sure you identify these because if you identify good positive factors or protective factors, you want to work towards improving those. If you find a lot of risk factors, you want to target those, not all of them, maybe one or two, and reduce the amount of impact that those risk factors have on your community. Then you also want to update the assessment as needed. As I stated earlier, this is a living document. So it's not something where, okay, yeah, we did it once and that's it. That's the end of the day. No, you are going to look for more data as time goes on. As you get new partners around the table, as more people get to see the work that your coalition is doing, you're going to want to get more data to make sure you're telling a deeper story and make sure that you are honestly assessing what's impacting your community. Because if you are saying that you want to do X, but then all the data is pointing to Y, why would you waste your resources, your energy, your funding, anything like that, working on X if that has nothing to do with what's happening in your community? In the next step, you're looking to build capacity. And just one thing I want to point out, I might say this a couple more times, but this is not a, you get to one level and that's it. You get to the next one. No, this is going to be a level, something where you're constantly going around that flower. So you're constantly going around that flower. It's not that you're at one particular level and that's it. No, you don't go from assessing to capacity to planning to implement. You might be at uh, building capacity before you even have an opportunity to start collecting data because you want to recruit people to be part of your coalition. So don't think of it as I'm going to step one, then to step two, then to step three. No, think of it as a process where everything gets basically put together into a pot, and you build as you go along. So building capacity, uh, as far as CATCA is concerned, it's defined as increasing the ability and skills of individuals, groups, and organizations to plan, undertake, and manage initiatives. So you're looking to work with partners to expand the amount of work that you can do as a coalition and expand the opportunities for you to have a positive impact. It improves those chances, as I stated earlier, of not just doing good work now, but into the future as well, and making sure that your work is long lasting and the positive, or that big S word, sustainable, which we'll talk about later on. And it gives you an opportunity to establish clear guidelines of what your team should look like or what your coalition membership should look like in order to make sure you get to that long-term improvement of the targeted health outcomes. So as you think about building capacity, think about these four elements. First and foremost is membership, then it's your organizational structure, leadership, and then providing training to the coalition members. So with membership, you want to make sure that you do targeted recruitment. So you're looking for the right match. Who is the right match for the work that we need to get done? So it's not just let's pick anybody. It's who would be effective to the work that we need to get done to improve our targeted health outcome. It's always good to have members, but if the members are not effectively helping you improve the work that you're doing, it's not the best partnership to have. Some things I want you to consider when you are looking at membership. Effective coalitions make it easier for their members or their coalition itself to engage partners that share what they have to offer in ways that fulfill their own mission and goal. So you're kind of looking at that pink area, the with them. What's in it for them? What is in it for them to be part of your coalition? They, they might not want to be part of your coalition, uh, but they might be an effective partner to help you get things done. So if you are looking to do some work with mentoring, or there's a lot of violence in the community and you want to bring community policing or improve community partnership with the police, there might be some officers who say, well, I don't really see how this can be positive. These folks are always getting in trouble, uh, X, Y, and Z. If you can see what's in it for them and kind of promote to them the fact of if there's individuals who you can partner with in the community and increase relationships, that might decrease the amount of violence that we see. If you connect the dots for them, they will be part of your coalition. So that's the with them. You also need to understand, going back to the middle there, that everyone's level of activity is going to be different. We live in an area where folks are very busy. Folks might have multiple jobs, and they might not have time to be a part of your coalition on a consistent basis. But that does not mean that they are not an active member of your coalition. You can say, hey, you might not be able to come to a meeting, but if I call upon you and I ask for some help, can you help? And that might be the way that they are active. So don't think of it as a certain level of, oh, if this person doesn't come to every single one of my meetings, then they are not an active coalition member. That's not true. Just remember that. It's different. Be realistic with the fact of the work that you're doing, the community members that you have around the table, and what they can bring to the table. as far as their time and their energy. When you look at the organizational structure of a coalition, effective coalitions have a structure and processes that are clear and apparent to all their members. So you have to make sure you do a couple things. You have clear roles for your coalition members and the staff, just to make sure if you have staff within your organization or your agency, that the staff are not burdened with all of the work of the coalition, and that it's a group effort between the members and the staff. Make sure you have some tools or some documents to help make sure that you are legitimate. So making an org chart of the coalition, having a timeline or details on the work that you're going to be doing, creating bylaws, making sure that you have clear bylaws to have a structure in place. Make sure that you're action oriented. So you're not just sitting around talking all the time. You're acting, you're doing work. You're constantly working towards the changes that you want to see in the community. Make sure you're communicating with everyone. And of course, depending on your structure, that you have the official legal and fiscal structures in place and practices to effectively work in the community. As it pertains to leadership, it's important for you to understand that you have to build strong leadership by being well coordinated, strategic, and attentive to the community's most important resources, which is the relationship among people and and other organizations. So, a goal of effective coalitions is recruiting strong members into various leadership positions on the coalition and making sure that those members understand that relationships matter. And the more relationships they build with the coalition or for the coalition, the better that our health outcomes will be moving down the line. So you have to make sure you have strong leaders who will represent you well as a coalition and will have the vision to do outreach, to recruit, and to promote the hard work that you're doing together. And coalition leadership needs to address practical and relational concerns at multiple levels. So at the with internal processes, you need to make sure that you manage those well, including promoting openness and trust among members. So you don't want to have meetings where folks are just fighting with each other, yelling at each other, talking over each other. You want to make sure they run smoothly. You want to make sure there's open communication between everybody, and that there's clear conversations and respect among the membership during the meetings, during and after. And also, effective coalitions, you have to bridge to and influence activities and resources in the larger community. So you need to make sure that the coalition's efforts in the community are moving it towards its goals. And you have to educate the community on the work that you're doing and why it's important for you guys to reach these goals. When it comes to training your coalition, you find ways to train and enhance the skills of your coalition members, the knowledge that they bring to the table, and everything that they have. So it's either through working with partners like Adapt to increase training opportunities for your members, or it's finding out what other webinars, other programs, other partners might be able to come in and do, a lunch and learn with your coalition members, or take a half hour, 1 hour from one of your coalition meetings to educate them on things that are going on. Some examples are of training opportunities are assessing the capacity across the SPIF model, ensuring cultural competency with their processes, troubleshooting any capacity issues, and then providing other types of trainings that might be needed. Now we move towards planning, where you're looking to look into the future and make sure that you're planning effectively for the work that needs to get done. So this is where you're strategizing, you're analyzing to make sure that the work that you're doing is going to be effectively done in the future. You do this by creating a strategic plan, creating an action plan, and you're looking down the line. Like I said, it's a 3 to 5 year period. It's not just now; it's into the future itself. You want to make sure that you effectively target what you want to do in the future to impact your targeted health outcome. And also understand that you could do some work that might be impacted by your current funding, or that you might need to get future funding for. So just make sure you understand that when you're planning as well. Now let's talk about effective ways to plan. And some of this, as I stated, earlier might be not above your head, but might be confusing for now. We'll be looking to do other future trainings and webinars and presentations to help dig deeper into some of these topics. So if you're looking for more details on what I've been discussing here today, I would hope that you fill out our survey, send me an email, reach out to us, and have conversations with us about what you would like to see moving down the line. But for example, here we're talking about logic models. We'd like to do another training to explain logic models to you and give you some more details on that. So with effective planning, you're looking to develop a logic model and then use that logic model to build your strategic and action plans. Within the logic model itself, you're going to have a problem statement, which is the main issue that you are targeting. So, for example, for us at Adapt, we have a couple of logic models, one related to alcohol, which is our problem statement. We have a problem statement specifically for alcohol for underage drinking. We have a problem statement specifically for prescription drugs. So, those are the big targeted health outcome that you want to work towards. The root causes are how is that targeted health outcome affected in your local area, in or not in your local area specifically. I'm sorry. The root cause is a higher level of why is this a problem. So, for example, in our work where we work with underage drinking and prescription drugs, one of our root causes is access and availability. These items are easily accessible and available in our community. Then the local conditions are what specifically in your community are impacted by the access or availability. So is it that merchants are not carding? Is it that other family members or older family members are giving alcohol to minors? What are those local conditions that are impacting the problem that you are looking to work towards? So these are the different pieces of your logic model that then you will use to develop a clear picture of what you want to do in your community by developing that strategic plan, the action plan, and also identifying interventions that you want to work on. Those interventions will be listed within your logic model as well. Along with that, you want to make sure that you have the what's called the VMOSA. So you want to build a vision statement for your coalition, build a mission statement, the objectives that you want to work on, the strategies that you want to work on, and then an action plan. And I'll explain that a little bit more here. So your vision statement is what the coalition wants to accomplish in the future. So this is like your pie in the sky, your high level. This is what I would love from the work that our coalition is doing. Your mission statement is more specific to what you are doing and what your role is to make that vision a reality. So it's what your unique role plays into making sure that the problem that you're focused on improves. Then you create objectives, which are specific, measurable results that you want to achieve. You know, you're looking at data-based objectives, and you want to look at objectives that will target the problem. So that long-term issue that you're working on. So war problem, underage drinking. You know, we have some objectives that target that, and you have some objectives that target the intermediate, which are the root causes. So we have some targets we have some objectives that target the root causes. And then finally, the local conditions, the shorter term. What in the short term can you do to impact underage drinking in your community? And that's targeting those local conditions. So all of that will be identified in your logic model. Then you start working on strategies. You try to figure out what are those strategies that we will work on to impact those objectives, the policies, the practices, maybe some programmatic changes that need to be made to impact the local conditions that you've identified. And finally, you'll develop an action plan or action plans to make sure that all of your coalition members understand this is what we have to work on and this is what we're going to work on together to support our community, to make sure that we're held accountable and make sure that we get effectively make changes to our targeted health outcome. Our next step is implementation. So you're almost there. You're almost at the level where you're going to get work done. But even within the implementation stage, you still have some more planning to do to make sure that you effectively get the work done. So there's some four important steps that you should touch base on while you're doing your or while you're getting towards your implementation. First and foremost is prioritizing strategies and action plans that you want to work on in your community because you can't do everything. You might list 10 or 12 strategies that you want to work on, and you might have action plans for each one, but you can't do it all. You won't have the funding, you won't have the resources to do that. So you need to target a way or figure out a way to make sure that you're more targeted with the approach. Obtain resources, of course, get funding, implementing the action plan itself, and then ensuring the fidelity to the implementation. So, first and foremost, you're prioritizing your strategies and your action plans. You should be asking the following questions and make sure you answer yes to each one before you start implementation. So, do the local conditions represent specific, identifiable, and actionable behaviors or conditions in your community? So, this is making sure that what you've identified is actually something that's happening in your community. Do you have at least two pieces of data that you can measure, that you can use to measure the change in the local condition? So, do you have some data that can help you back up the work that you're doing to say that you are making changes? Are there strategies identified to change the local condition based on evidence of strategies that have empirically demonstrated the ability to change local conditions in similar communities? So, do you have an evidence based program that's been successful, or are you just doing something that you just want to do? Make sure it's evidence based. Are there strategies that are comprehensive, which means that they include multiple components, like the 7 strategies that I explained earlier from Katka? And do the strategies contain enough dosage to change the community environment for the defined community and achieve short-term objectives? So, are the strategies something that's uh, actually going to make an impact in your community? Just before we continue, I just want to make sure I give you some examples of those comprehensive strategies that include multiple components and how we've done that here at Adapt in Essex County to prevent substance use and abuse. So first and foremost, you have providing information. This is an example of we had a parent who had a young son that was starting sports or starting middle school, I'm sorry, and getting into older friends and working with older friends. And she was concerned about potential drug use. So we created with her this pamphlet that kind of gives you a conversation points on drugs and how they impact a student's or a youth or an individual's performance on the field for whatever sport they have. So you can have a better conversation rather than just say no. This gets you into a deeper conversation. This is right here, enhancing skills. So we have workshops. This was a workshop held by our interfaith committee where we had about 80 individuals learning about trauma informed care. This is providing support. So we're creating other alternative opportunities for youth in Essex County to do some productive work rather than not having an after school program or not having something that they can be a part of moving down the line. Enhancing access and reducing barriers. This is an example of one of the brown bag events that I spoke about earlier. This is a brown bag event that we had in Montclair, and we have great partners like the director of community health services here in Essex County, who's there in the picture, doing some work to make sure that we reduce prescription medication misuse and abuse by older adults and their families. Changing consequences. So this is providing incentives. So we have a yearly thank you dinner for our coalition members where we recognize coalition members for their hard work throughout the year. And then we just make sure to provide them with a nice little meal just to say thank you. Physical design. We've been working very hard with various schools in the community to increase signage at schools, at athletic fields, at parks related to vaping and smoking, and making sure that folks understand the impact of that and the Clean Air Act, or I'm sorry, the Smoke Free Air Act here in New Jersey. And then finally, modifying programs or modifying policies. On the right, there is a picture of the prescription medication disposal box. This is our newest one that we launched over in Maplewood. This is just an example of the work that you can be doing in your community to make that long term impact. When it comes to obtaining resources, you're looking at this is where you start looking at the money. You need money, you need funds to be able to work in the long term to create longevity for your coalition. So you want to make sure that you're developing a clear picture of what resources you will need to be successful with your coalition. And you want to make sure you develop a budget that includes not just cash, but also in kind resources that you're going to need to make your coalition successful. So, cash, of course, is the funds, any grant funding, any money, any donations that can help you purchase material, supplies, or anything else, any contractors that you might need or consultants that you might need to do the work that needs to get done. In-kind resources could be office space, could be skills, any technology that can be offered to you by any partners, any transportation that can be offered, or any other items. If somebody donates food for a meeting, things of that nature, those are in-kind resources that you can use for your coalition to move forward in the work that you're doing. Now, you can get into action. You can get into actually implementing the action plan that you've developed. This is where you need to mobilize your resources to make that action plan a reality. You need to analyze, organize, and grow both your internal and external resources and relationships. And now that you're implementing, this is where you're going to be expanding and making that possible. And before you officially get down there, just make sure you review a couple things. How much capacity have you built, and have you recruited enough members? So when you're looking at the capacity that you currently have, you should ask some questions to make sure that you have enough capacity to get the work done. So ask yourself a couple questions. I won't go through all of them right now, but these are just some the questions that you should be asking yourself. Who within the coalition or what partners that you might have taken leadership roles to implement the strategies that you've identified? Have you identified and formed any key relationships and partnerships that you need to implement the strategy? Have you secured enough resources to implement the strategy? And how will the coalition spend time at monthly meetings to make sure that you stay focused on the implementation that you need to do? When you're looking to recruit partners or other members, you need to think outside the box and see if there's any other partners that you need to get your strategy implemented effectively. Now, look for people who might have similar interests or goals to the coalition in order to make sure that you get some things done. Some questions that you can ask when you're looking to identify your partners is, whose problem is it? So it's not just your problem, it's probably the problem of other people as well. Who's directly or indirectly affected by it, and make sure that those folks are around the table. What groups are they organized into? So remember, a lot of folks will work in silos. Your job is to break those silos. So what groups or what silos are currently in place that you don't have around the table? And what can you do to bring those people into the table? Next piece is that you need to make sure that you are holding the fidelity to the implementation process itself. So, according to the Substance Abuse and Mental Health Services Administration, or SAMHSA, implementation fidelity describes the degree to which a program or practice is implemented as intended. So, you need to make sure that if you're using it, or not if, but when you're using an evidence based program, you should be trying to keep the fidelity and keep the same aspects of the program in place as you move forward. So the original design should be something that you are keeping in line with to make sure you get the same results that were given when they studied this evidence-based program. So remain faithful to the original design of the program while making sure that you address the unique needs and characteristics of your target audience. So, of course, you have your own community, you have your own target audience to be concerned about, but you're using this evidence based program, and you need to make sure that you do not modify it in a way that it's not going to hold fidelity to the original concept. So, Samsha identifies some important things you should consider to make sure that you are keeping to the fidelity of your implementation. So, you should retain the core competencies that were in the original design. You should build capacity before changing anything. You should add rather than subtract from the original design. You should adapt with care. And if you're adapting, you should consult with the experts first. Step 5, as we move through the strategic prevention framework model, is evaluation. So, evaluation involves using specific information to tell the story of how the coalition contributes to the community level changes in your targeted health outcome. Understand local concerns, report on your work and monitor progress, and report data accurately and appropriately to all stakeholders. So, this is where you're telling your story and making sure that people know that your coalition is the reason why things are happening or positive things are happening in your community. So, when you're conducting your coalition's evaluation, make sure you keep these 4 steps in mind. You confirm the data that's on your logic model, you document your coalition's work, you tell your coalition story, and you develop a data coalition work plan. So when we talk about confirming data, you're reviewing the baseline data that you originally had in your logic model, and you use the new data to make sure you measure the changes in those different levels of your logic model that we spoke about before: the problem statement, the root causes, and the local conditions. When we talk about documenting your coalition's work, you want to make sure you document all of the efforts. These are your outputs. These are what you are doing on a consistent basis to make sure that your targeted health outcomes are improved by the work of your coalition. So you need to make sure that you identify how they've been contributing to the changes that you have identified in your logical model. This includes adding any new or change processes, programs, services, or community resources, and any media exposure that you've gotten, either through traditional media like the newspapers or the local news, like the News 12 or anything like that, or any exposure that you are doing on your own social media platforms, because those can count as well. And you add, you make sure that you include how many impressions you've gotten. So how many views, how many likes, things of that nature, or how many people have probably viewed your show on or your segment on News 12, NJ News 12. Things like that are good for you to include and document the work that you're doing. Next is telling your story. Brag about yourself. Make sure people know about the hard work that you are doing as a coalition. In order to be sustainable, in order to build the support in your community and to recruit new members, you've got to brag about yourself. You got to describe how you and your partners are contributing to the changes that are happening and to the improvements in the targeted health outcomes. And the next piece, the final piece for this area, is developing a data collection work plan. So all of your coalition members should be involved in this process. So it's not just the staff members, it's not just key leadership. Everyone should know what you're doing when it comes to evaluating your coalition, and they should be part of the process itself. And you can do this by creating an evaluation work group of members who are suited to and interested in telling the coalition story. So you might have coalition members who are braggadocious. They want to brag about you. They want to make sure everybody knows what you're doing. Those folks should be part of this group. As we move towards the next step, it's sustainability. You need to sustain the work that you're doing. And the coalition sustainability can be defined as the following: having enough resources to intervene at the community level and maintaining these resources long enough to see population level outcomes. Look, we know that the change that you want to do takes time. It's not going to happen overnight. You need to make sure that the coalition is sustainable enough to be there as we move forward, as we make sure that this is a long-term change and a positive change in that targeted health outcome. And sustainability, you're looking at 4 initiatives that you can do to make sure that your coalition is sustainable at making population level changes. One is engaging a diverse group of volunteers and partners and building and sustaining their involvement over long term. So you don't want a partner to just be there for one time only or to take a picture. You want a coalition member that's going to be with you over the long term. You want to build a credible process that clarifies how the coalition will sustain its work and how it will keep its fidelity to the strategic prevention framework model over the long term. Because you want to make sure everyone understands how to use the SPF model to build your coalition and to strengthen your coalition. This will make sure that it's a long-term success. You want to ensure that the coalition's relevance goes beyond your membership and reaches the community at large. As I said earlier, you want to brag about yourself. You want to make sure people know about you, because if something happens where you lose some funding, you want to make sure folks are out there to defend you and fight for you and fight for the hard work that you're doing to improve the health outcomes in your community. And finally, you want to create a sustainability plan that looks at your financial and in-kind resources and tries to see how they can sustain them long enough to achieve your long-term objectives. Next, you're looking at cultural competency, which is the last piece of the strategic prevention framework model. So with this, it impacts all aspects of coalition building, and it must be considered in every element of the strategic prevention framework model. It's very important because you want to make sure that you're building capacity that includes a diverse subset and a diverse group of your coalition members, not just including the demographic diversity, but also diversity of skill sets and different skills that people have in your community. Some things that you should consider when you're talking about cultural competence with your coalition are that you want to make sure that you commit to cultural competence, that it's not just something that you're saying, but something that you're doing and that you're showing from the top level all the way down. You want to identify the culture and diversity in your community and make sure that that's identified within the coalition itself. You want to build the cultural competence throughout the strategic prevention framework model. So it's not just something that it's not an afterthought. It's not, oh, I did all of this. Okay, let me check to see that, something was cultural competence. No, every step of the way, you want to make sure you're being culturally competent. You want to recruit members and other community-based organizations to represent the diversity and the culture of your community. This is one reason we're excited at ADAPT for creating our new LGBTQ plus committee, because we want to represent the diversity of all communities in our county, and we want to hear and support the voices of our LGBTQ plus community in Essex County. And we've got some great partners around the table and some great leadership that are taking over this committee to support the work that needs to get done. And finally, you want to create opportunities or mechanisms for disenfranchised or hard to reach populations. And this is going to take time. So not right off the bat will you have full representation of folks from disenfranchised or hard to reach populations, but you want to make sure you get there and that you involve them and you include them in the work that you're being done, and that their voices are heard and that they're becoming leaders in your coalition. All right, so we've gone through the full strategic prevention framework model. We've talked about the public health approaches. And, we've given you some background on some work that we're doing at ADAPT. But now, how do we make sure that your community takes you serious as a coalition? Here's some starting action items for you to go through as you start to build your coalition. First, you want to host a planning meeting with a core group of key stakeholders, 8 to 10 people max, where you're sitting down, you're reviewing your target health outcome, and you want to make sure that you have an agreement. At the end of the day, your action item is an agreement on the formation of the coalition and the work that needs to get done to improve your targeted health outcome. Once you do that with that team, you create a tentative meeting schedule for year one of the coalition. So this is just the core group that's going to make up your core group of the coalition. You're going to come together and create a meeting schedule, and then you're going to move forward to hosting your first meeting and all of that. But for now, get that core group together, get some core discussions in place, and then move forward through the next piece. After you do that, you have your schedule in place. You better schedule that first meeting as soon as possible, get that energy up, get everybody excited about it, and move forward in a productive manner. You want to identify the key stakeholders and community leaders that must be present at that initial meeting. And you want to make sure you send out personal invitations via phone. So, call folks if you don't have their numbers, email them, but just have that personal touch. Follow up with them as much as possible to make sure that they are there, that they get to the table, that they get to the meeting. Select an appropriate location for the meeting. Make sure there's ample parking in place. Make sure it's not hard to reach. Make sure it is ADA accessible for anyone who might be disabled or might not be able to move uh, or go upstairs per se. If possible, get some snacks, get some refreshments, get something donated if you need it. But get something to entice folks to be there. So if it's a snack, if it's some sandwiches from a local sandwich shop, whatever way you can, whatever the resources are available to, do it. Next, make sure to work with that core group to plan your meeting agenda and make sure you have key items or key action items that are going to be required for that coalition. And then finally, host that meeting. Host that meeting with these key stakeholders. Get excited. Make sure that energy is up. Make sure you are highly positive and promoting the fact that you all working together can create the positive outcomes to make changes in your community. And then follow the guidelines that were set forth in the strategic prevention framework model that we've been discussing here today. Before you get to that first meeting, you want to make sure you have a compact and organized agenda. You want to make sure that meeting runs smoothly. As we stated earlier, you don't want folks talking over one another. You want to have a very respectful meeting. So set those boundaries, set those guidelines early of what you want the meeting to look like and how you want everybody to be respectful and not talking on top of each other, things of that nature. Some suggested important agenda items to put in place as you work towards this. Identify the community needs that cause the formation of the coalition. So you want to put it out there. This is the reason why we are forming, and these are the issues that we want to work towards. You want to explain the structure of the coalition, what the coalition is going to look like moving forward, if you're planning to have any committees, etc. The one committee you will be required to have, of course, is the needs assessment committee. We'll talk about that in a little while. You want to present a brief overview. You don't want to go through what I just went through with you of going into full details of the SPIF model, but you want to give them an idea of the SPIF model and why it's important for you guys to follow this. Discuss the need. You want to make sure you discuss the need to create a shared vision related to the targeted health outcome and the need to agree on shared values. So this is a partnership. You need to make sure they understand that this is a partnership. We are all working together and we all need to have a shared vision, a shared mission, and shared values. You might not be able to elect, but you should be able to discuss and identify the need to have coalition leadership. You might not elect the leaders right now, but at least discuss the need to have that in place by the next meeting at a maximum. You should not go after 2 meetings without your coalition leadership in place. Then you want to identify action items for your coalition between now and the next meeting. Like I said, the biggest piece will be creating that needs assessment committee, and then maybe working with each person that's there, maybe having an action item where each person that's there will invite one more person to come to the next meeting. That's their action item before the next meeting. Now you want to form this needs assessment committee. This is very important to make sure, as we spoke about earlier, that you're collecting all of the data that's needed to get all the pieces done from your logic model, your strategic plans, all of that done. You want to make sure that you host this or that the committee meets before you host your next coalition meeting, and you should not be waiting more than a month to hold the first committee meeting. You should not be waiting more than a month to hold this meeting. It should happen as soon as possible after the coalition meeting takes place. Here's some first action items required for the committee: the community assessment, the logic model, the strategic plan, the action plan, and the evaluation plan. These should be at least the first 2 for now should be your first steps in getting them done ASAP with this committee. You're not going to get it done in a month, but you should be working with them to make sure that it gets done in a timely manner. Once you get that done, you're going to want to present an overview of your needs assessment to your general coalition, and then from there, developing a presentation for the general public. Like I said, you want to tell the people what you're doing, and then you want to brag about the work that you're going to get done to make sure that you improve the targeted health outcome. Then you want to recruit new community partners and members who show an interest in tackling your targeted health outcomes. So start recruiting more people. Like I said, those core or those new members should be bringing somebody else to the table with them. And then you should identify other folks who should be around with you as well. Then you want to research and apply for any funding that's available to work on your targeted health outcome. And that's why you need your committee to work on all of these items so that you're ready to apply for funding. Then you want to move through all of the steps of the SPIF with the entire coalition so that you all grow together and you build a strong coalition. Now, what's next? You have ADAPT. We're here to be a collaborative partner. As I stated, we work on the substance abuse piece, but we want to be a support of the overall health and wellness, the improvement of the overall health and wellness of all of Essex County. So we're here to collaborate with you. We're here to work with you. And we're here to be a partner to provide more training and some more resources for you if possible. We at ADAPT, we stay true to our public health approach, basically meaning that we try to break the silos across all health issues in the community, and we want to work with different systems to bring a holistic approach to health and wellness here in the county. And as I stated before, we're here to be a partner. So whenever you need technical assistance, trainings, or support, reach out to us. We're here to collaborate with you. Right here on the screen, I have our contact information. So my information is right there up top, along with our two coordinators here at ADAPT, Jessica Delgado and Julia Revoredo. And Emily Falcone is our youth prevention specialist, working specifically with our youth programming, our schools, our youth serving organizations here in Essex County. And we have Christine Bizub, who's our older adults prevention specialist, working with the older adult population and with senior housing, senior centers here in Essex County. So we're here to collaborate and be a partner with you on everything. I said this earlier, but I would really appreciate it if you complete our survey. It will be right at the bottom in the description of this video. You will see the link. Please click on that link, take that survey for us. Make sure you give us your feedback and information. We really want to make sure that we are doing effective work here and that we are supporting our community and increasing the potential for health, improved health outcomes throughout the entire health and wellness spectrum here in Essex County. Thank you very much for taking the time to watch this presentation. We hope that it will be useful for you in the work that you're doing. We hope and we're very excited to see some more coalitions out there collaborating and working. And we hope that we can be a part of your story and be a part of the support that we're doing. So thank you once again. And please complete the survey, get the information out there for us. Thank you very much.